do not provide the postpartum beyond 2 months. Some of the states have gotten approval to do 6 months or some other number of months that may not be up to 12 months because that depends on the state's budget and what they can get their state legislatures to approve and what they can get CMS to approve. So again, we're sharing our unhealthiness with a group of other states across the South. Josh mentioned the uninsured rate among kids rising. So about 2% of 0 to 1 year olds were uninsured in 2018. And just to put a plug here, we produce a report every year called a Finish Line Report, and it shows all of the parameters for insured based on with a lot of different breakouts. Our report should be coming out within probably early next quarter for the Finish Line. And so you will see that we do have a lot of data that you can go back and look at. So what policies or legislation could help Arkansas improve? The top priority, the health department has a Title V or a maternal and child health program. And so their top priority is to improve preterm, low birth weight, and pregnancy outcomes. That's one of the policies that's already in place. For postpartum care, as I mentioned earlier, Medicaid postpartum care is terminated after 60 days. So what you have is just 2 months after the baby is born, the mother is getting used to caring for an infant, or caring for a newborn, really, dealing with complications from childbirth, possibly experiencing postpartum depression, and then suddenly her insurance is gone. She may, if some of the women that are on Medicaid may be in transitory situations, so they may not get the notice, they may not have the assistance to reapply. And so what we're proposing as a state is that Arkansas could accept the opportunity to provide 12 months postpartum cover. They could put opportunity and get a waiver to allow those women to be covered. They should be covered all the way up to that first year of the baby. The baby is already covered by Medicaid rule, but the women are not covered. And so we're looking to try to get some legislation passed on that. And if we're working on it for this session. If we don't, we'll keep working on it until we try to get it done. So also, maternal mortality seems to be on everybody's radar right now. There were over a dozen bills introduced in Congress in 2020 addressing maternal mortality. But of course, not much got through because, the Senate really didn't do very much in terms of passing legislation that for anything other than COVID. So under the new administration and with new congressional makeup, some of these bills should get passed this year. CMS has also proposed new initiatives to address maternal mortality, and that's encouraging too. For early prenatal care, the state Medicaid program could allow for pregnant women to get coverage under what we call presumptive eligibility. Let's say if a woman goes to a clinic and is discovered to be pregnant, she could do a temporary application and go ahead, and if she appears to be eligible without the full process happening at the clinic, she could fill out an application, and that would allow a provisional application that would allow her to begin her prenatal care immediately while the full application is being processed. We actually had that in place for a long time in Arkansas, and then after the Affordable Care Act and after Medicaid expansion was introduced in Arkansas, it's not happening anymore. And we could set specific goals to reduce racial disparities in maternal and child health issues. So again, how can you help? If you are with an organization that provides maternal and child health services, you can support our efforts to get Medicaid changes mentioned above. You can support legislation. You can get your organization to support our efforts. You can support legislation. If you're also as a provider or just as an individual, if you know anyone that may not have coverage or have access to coverage, inform the women of Medicaid or marketplace coverage. If let's say if a young woman that has never needed Medicaid or never had Medicaid, and let's say she lost her job this year or something, she may not know that she's eligible for those services. So again, a lot of it is just knowledge and sharing with people what's available to help them. And with that, Rebecca, I will stop.
Thanks, Loretta.
You're welcome.
Next, Matt Vermillion, who I don't think I introduced at the beginning. He's with Delta Dental Smiles, and he'll be talking about dental health.
Yeah, thank you so much, Rebecca. Can everyone hear me? If you can, give me a nod. Perfect. So, how Arkansas is doing with regard to dental health? Um, I could go through a lot of things, but I'm just going to start with facts. Arkansas ranks near the bottom, 48th to 50th, depending on what survey and site you go to. The most recent one was published by Wallet Hub, and it ranks Arkansas 50th in the nation with regard to dental health. They have us ranked 49th nationally in the percentage of adults with poor or fair oral health, and 49th nationally in the percentage of adults that have visited a dentist in the past year. We're ranked 31st nationally in the percentage of adults who have experienced oral pain in the last year, and 27th nationally in the percentage of adolescents who have visited a dentist at least once in the past year. Now, that's important because Arkansas Medicaid does cover at least one dental appointment for the adult population and at least two dental visits for children. Um, and from the work we do at Delta Dental with our Delta Dental Smiles population, which is our program geared towards our Medicaid recipients that have been assigned to us, those numbers kind of match. We've got about 10 to 12% of our population in the adult Medicaid program that currently receives treatment, which I'll talk on a little bit later as to what we think the root cause may be. But keep in mind, Arkansas has a very apathetic nature when it comes to oral health. Many Arkansans believe if dentures were good for me and my parents, then they're good for my kids. So we have a very strong behavior change that we need to address in order to solve some of these issues. But to kind of go back to facts, I don't want to leave you just there. So last year, the Arkansas Department of Health Office of Oral Health conducted a basic screening survey of third graders in which they found that 64.8% of Arkansas third graders had at least one cavity in their lifetime. Now, that cavity could have been filled or it could have been active, but they have at least the history of having one cavity in their mouth by the time they reach third grade. Also, 21.4% of Arkansas third graders have at least one untreated cavity. Now, that may not sound like a lot, but we have nerves running through those teeth. So when those nerves get exposed to air or water or heat and cold, it causes some extreme pain that can impact the child's ability to perform well in school and could also lead to discipline issues. In addition, 37.2% of third graders in Arkansas have had at least one dental sealant placed on their permanent molars. And for those of you that don't live in the dental world, a dental sealant is simply a thin coating that's applied to the grooves or the inside part of your adult tooth to help prevent food from getting stuck. So when you brush your teeth, your bristles are not always small enough to remove all the food from your surface of your tooth, and those sealants go in there, fill in those grooves to help remove any potential for decay to form on those teeth. Additionally, over 80% of all cavities found in your mouth are going to be found in your molars. Um, so, with that being said, Rebecca, we can move on to things that we can continue doing. So, Arkansas is actually one of the top states nationally when it comes to public water fluoridation, where we have nearly 86% of our public water systems in Arkansas provide water fluoridation. Now, I bring that up because almost every session since that law was passed, we've had someone try to fight that bill to remove that requirement of public water fluoridation for systems, I think, greater than five that serve people greater than 500. Um, so there's some things there that we need to be mindful of. We need to ensure that um, we're being proactive against legislation that would come in to remove the public water fluoridation. For those of you that don't know or unaware, fluoridation in water is a great way to provide vitamins that strengthen your enamel in your teeth and help you fight the prevalence of cavities or the bacteria that cause cavities. In addition, um, as far as policies and legislation that we need to do is um, we currently have an EPSDT mandate that requires dental screenings, and Arkansas is one of the top states nationally in actually doing the dental preventive screening, but that's still only about 52% of our kids. So in our Medicaid population, we've got roughly 400,000 kids in this state. So if they're constantly participating in their EPSDT at a higher rate, it will allow us to triage kids that may have dental needs before they get bad and create referrals to go back to the dentist to get those smaller issues taken care of. Rebecca, we can move on for advocating for dental health. So tooth decay is the #1 chronic illness in kids, and it's the most prevalent chronic disease in both children and adults. But the caveat is almost 99% of it is preventable. So prevention is the #1 key or weapon against tooth decay. And prevention comes in many forms, like regular brushing and flossing, eating healthy foods like fruits and vegetables, drinking water, getting preventive dental procedures like dental sealants and fluoride. But more importantly, visiting a dentist regularly is one of the best ways to prevent tooth-related problems. Now, I bring that up because we currently do hearing and vision screenings in schools because we know that poor vision and poor hearing can impede a child's ability to be successful in the classroom. So we address that by screening those children and then referring them for treatment. Dental health is no different. If a child has a toothache, it can be distracting, causing the child's schoolwork to suffer, and may lead to absences or poor self-esteem. As I referenced earlier, Arkansas ranks near the bottom nationally when it comes to dental health. To change this, we really need to advocate for dental screenings or dental risk assessments as part of the hearing and vision screenings that we currently have. And with that, Rebecca, I will turn it back to you.
Thank you, Matt. So now up next is Miss Consavella James with Treatment Homes of Arkansas, and I'm going to go over to her slides. Okay, I think we're good to go. Oh, you're on mute.
Oh, sorry. Okay. Good morning, everyone, and thanks for inviting me to participate on this. This has kind of been depressive in terms of the issues that we're dealing with and the problems that we still face in Arkansas. But I do have some good news talking about mental and behavioral health. And of course, there are a lot of issues with the past, but Arkansas does have a strategic prevention plan that's coordinated through the Department of Human Services and UALR Mid-South Center for Prevention and Training. And this plan has been in place for several years, and they have come up with information and they have tracked prevention efforts and outcomes in different areas. And one of those, of course, their focus has been on promoting prevention and protection for children. We can move on. I'm not going to go over all these slides, but you'll have those available. This is the National Strategic Prevention Plan guideline that Arkansas uses for that. So we can go on to the next slide. And in that plan, you can see assessment, capacity, planning, implementation, and evaluation. Those were the key things. Well, what has Arkansas done? And one of the things that this group has done is in relation to alcohol use rate among middle and high school students in Arkansas. You can see in 2002, if you rolled that up, in 2002, our rate of alcohol use among middle and high school students was 27.3%. In 2016, it was down to 11.1%. So that's encouraging for that rate to go down. And of course, the forecast was that we'd be down to 9.1% in 2021. The next area has to do with cigarette use. If you'll scroll down, and you'll see there's been a major decrease, 16.6 in 2002 down to 5.6 in 2016. So hopefully those trends will continue and we will get to the point that that's not a major issue. The next area is, of course, e-cigarettes. That's been a real challenge, and that continues to be a major issue. You can see we've not decreased very much in that area. Of course, that's a new issue as well. So we're going to have to work a little bit harder to deal with those issues in relation to e-cigarettes. Prescription drug use. Thankfully, Arkansas has not had a major issue. Of course, any prescription drug use among our youth is an issue, but we went from 5.6 in 2008 to 3 in 2016. So hopefully that will continue to decrease. Now, one of our big areas of concern has to do with the use of marijuana among our middle and high school students. And you'll see in 2008, we were at 64.1%. That's a pretty astonishing rate, but we have made progress and we're down to 41% in 2016.
I do. So just. I didn't mean to startle you. I didn't realize anybody was.
I think you're good to go.
Okay, I don't know what happened there. And then another area has to do with binge drinking, and that has decreased, not enough. We're from 29.9 down to 25.9. So we still have work to do there. And another major area has to do with opioid overdose death rates in Arkansas. And you see in 1999, that wasn't even on the radar screen, 1.1. And now in 2016, we've gone up to, well, we went up 2015 to 7.2, came down to 5.9. And hopefully that will continue to decrease. But we can see that the opioid use is a major issue for us. Drug overdose death rates in Arkansas, 4.4 to 2016 up to 14. That tells us that we have a lot of work still to do in that area. So you can actually find this report. There's a lot more information, but you can find that report on the DHS website, and the sources are listed there for you. Okay, now we're moving on to policies and our legislation that could help Arkansas improve. And we are doing some good things in Arkansas in terms of behavioral health. And one of the things that has happened on a national level is that the American Medical Association has partnered with other national organizations, and they've focused on developing integrative services. So one of the things that we can do in Arkansas is continue to promote the integration of behavioral and mental health care into primary care. And that's one of the things that the past was supposed to do, was to integrate those, all those different areas. And you can see there's information there where you can go to that website and get more information. But we do have a network in Arkansas. The Arkansas Behavioral Health Integration Network receives $750,000 to reduce suicides in rural Arkansas. So it was kind of astonishing that in Arkansas, more than 4 times as many people died by suicide than alcohol-related motor vehicle deaths in 2017, amounting to a death by suicide every 14 hours. That's just mind-boggling. And so certainly there needs to be a lot of work in that area. And then Arkansas Behavioral Health Integration Network also received a $200,000 award to improve treatment and recovery services for opioid use disorder in rural Arkansas. So you saw the stats earlier in terms of opioid use and how we've gone up. So that's certainly a challenge that is still before us. In terms of supporting behavioral health, combining behavioral health or primary care, we have information that supports that and indicates that that is the way that we should be moving in terms of improving health, mental health, and primary medical care services to our citizens in this state. In terms of mental health issues and the COVID, of course, everyone has been reading or you've heard about on the news how mental health issues have spiked, and that is certainly true. And I have some additional handouts that you'll be given that will give you more information about what's happening in Arkansas, what the community mental health centers are doing. I didn't cover a lot about PASS, but did give information about what PASS is. I think a lot of our citizens are not familiar with the PASS system, and there remains a lot of problems there, but hopefully that's going to improve. And then in terms of another piece of legislation that can help, and this is directly in relation to our pandemic, the COVID virus, and what behavioral health has had to do to meet those needs. And we have been using telehealth services. And that has turned out to be a win-win situation, because we're able to provide telehealth to, actually, we've been able to provide more telehealth services, appointments, people are keeping appointments, and time, travel, all those things are not a major problem by using telehealth. But this particular House bill has been submitted, House Bill 1176, and it is basically a bill to expand the use of telehealth services beyond the pandemic. The governor executed several executive orders to allow the different professional groups to provide telehealth services, because that was not included in their law or in their professional view, or that was not included as one of the credential activities. So this particular bill will allow that to be expanded. It'll be codified, and then telehealth services can be provided to everyone. And for Arkansas as a rural state, that is really something that we need to look at. So there's a copy of that particular bill, but you see it includes psychologists, professional counselors, marriage and family therapists, clinical social workers, master social workers, crisis intervention services, which we've had a major increase in crisis services during the pandemic.
Ms. James, I'm sorry to cut you off, but we just have 3 minutes left, and I'm
Okay.
going to give Loretta to give a 1 minute overview of the COVID-19 crisis, but you do have these talking points that people can use if they want to advocate on the telehealth bill, and you have lots of other resources I'll share in a follow-up email too.
Okay, thank you. And all of those handouts, thanks to everyone who provided the assistance on gathering all that data. Thank you.
And Loretta, if you want to give that high level version, but we can share follow up resources too. You're on mute.
Thank you. Now, let me change my screen. I just covered up my, okay, I'm good. Consavella, you set me up perfectly. I'm glad you talked about the changes for telehealth, because that's one of the things that I was going to share. And so how's Arkansas doing with COVID? As of yesterday, we had 690 deaths. We have cumulative confirmed cases of 287,000, 12% positive test rate. Remember back in the spring, they were saying we couldn't open up until the test rate was down to what, 4 or 5%, and we were only at 10% then, and now it's, opening up is not even on the table in terms of what people are doing, but the test rate, but the positive rate keeps going up. So again, last week, 77% of the hospital ICU beds in the state were occupied, and for last time I looked, we don't even have 1,000 ICU beds in the state at all, and 50% of those were COVID cases. So racial breakdowns, as we know from the beginning, African Americans had a higher rate of infection and a higher rate of hospitalization. And at this point, our percent of the population is 15%. The number of cases is 18%. For Hispanic and Latino populations, they have only 7% of the population, but they're 11% of the cases. So with children missed a lot of dental services, early childhood screenings, mental health services, and vaccinations. And according to the health department, between July and January of this year, there were 75,000 fewer vaccinations given than in 2019. I mean, in 2020 is 21 now. I'm forgetting. So anyway, in 2020, they had 75,000 fewer vaccinations because of COVID for children than they did in the same time period of 2019. So the American Academy of Pediatrics is still saying that younger children remain substantially below the pre-pandemic baseline levels for visits, and compared to, and also people on Medicaid have stayed low. So what we can do is we can talk to those mothers and strongly encourage them to keep their kids vaccinated, to get their dental visits, to get all those child visits in, and get to those doctors' offices to get those services. For broadband, as Consavella talked about telehealth, we know that broadband is a major problem. The CARES Act just has put a lot of money. The state CARES committee has put a lot of money into broadband. I just saw a document yesterday that they signed on the end of December, to try to improve broadband across the state. So there's work going on there. Medicaid enrollment went up for Arkansas Works, went from 250,000 to 295,000. So I'm thinking that's because a lot more people lost their jobs. And for children, the increase is from 412,000 to 444,000. So not nearly as many children as adults. Communication, the state did a very poor job of communication, in my opinion, and still does to some extent, with people understanding what needs to be done to get tested, and now even to get vaccinations. The CDC commentary says that they suggest that more commonly used terms when engaging with community members, instead of public health terms like sheltering in place and social distancing and flattening the curve, just speak in plain language. So policy solutions, improve awareness about the spread. We still need to do that. Work to make sure that those folks that are homeless and don't have anywhere to isolate, make sure that that's known to the community, instead of waiting till somebody gets sick and then telling them, oh, we can put you up over here, because most people in the community don't know. So for workplace safety, we know that there was a big boondoggle there where a lot of folks in Northwest Arkansas got infected that should not have. One of the things that needs to happen is improved communication. Again, people in food service industries have a higher level of workers among Hispanics and African Americans. African Americans are also more likely to be in jobs Hispanics, African Americans, and other people of color are more likely to be in jobs that are considered essential workers, and they're less likely to be able to work from home. We had a lot of legislation at federal level, the Families of Corona Relief Act, FFCRA, and the CARES Act. At the end of December, they passed another law. And regarding vaccines, we're starting to do better with the state of Arkansas. We're just now in phase B, I think. And 221,000 people have been vaccinated as of yesterday, but we still got a long way to go. We're finding that there's some rumors in the community among certain segments of the population. If they call Walgreens and they can't get in, or they can't get on the list or whatever, they're thinking that it's a scam. So I was on a meeting yesterday afternoon with a group of folks from around the state and mainly clinicians, and they're saying that we have to fight that out in the community. There's still a lot of confusion about who can get the vaccines and how they can get it, and ultimately we know that there's just not enough to go around. The health department is having a clinic this Friday in Pine Bluff. And for those of you that may not have a vaccine and you have time to vaccinate, if you go and volunteer, you can get your vaccination there. So
we're about 5 minutes over now, Loretta. Well, thank you. That was super fast, but it sounds like there's a lot of education that needs to be done, making sure parents know to take their kids to the pediatrician, misinformation around vaccines, and we'll send follow-up resources about that. And everyone that has spoken today, if they have follow-up resources, I'll share that with you. And I'll also copy the questions in the chat box we weren't able to get to, and share those with the presenters so we can get responses to those questions. I appreciate y'all so much. We'll also share the recording, which of course I only started recording halfway through, so I apologize for that, but we will have follow-up resources. I thank you all so much for being here today. I hope to see you again soon at one of our other events. Bye.